leading high-performance health organization, LeHHO in short, as the first name goes, it's about leadership, and it's about leadership in healthcare. The approach we have taken is a responsible leadership. But we are saying leadership is not a noun, it's not what you are. Leadership is a verb, it's what you do. The approach we take in LeHHO is you as a leader create the atmosphere for people to solve their problem. You as a leader, if the problems were easy, they would already have been solved. So by the time you're coming in to address a problem, we recognize that it is a difficult problem. And difficult problems require learning. They require a new way of thinking and a new way of doing things. This is called the adaptive leadership approach. And the LeHHO program is based on that philosophy.
My name is Dr. Willie Sakwale. I'm a medical doctor by profession. Currently, I'm a special advisor to Kenya's End Malaria Council, and I also serve as the chairman of the COVID vaccine task force. Now, one of the things is I reflect back to the time when I started my career in medical profession as a medical officer. 2 to 3 years after I graduated, I was made to be in charge of the district. We called them then district medical officers of health. And that position had a lot of requirements. All of a sudden, without any training, one was responsible for financial resources, human resources, day-to-day management of health facilities. And definitely these are skills that one did not have. And we did a lot of learning on the work, and it wasn't easy. The learning curve was very steep. And then got to the Ministry of Health, where I was in charge of programs, starting with the malaria program, but I also managed all the infectious disease control programs like HIV, TB, and malaria. And these particular programs definitely require a lot of leadership and management skills. So that is why I made a purpose to enroll to the LeHHO program, so that I could enhance my skills in not only leadership, but also management.
After we've taught you about leadership, then we go further and situate your leadership practice. So we start broadly by looking at the global scenario. What happens in the rest of the world, and how does it impact your clinic or your hospital or your dispensary or your pharmacy? From there, we look at the global players. We look at WHO and other United Nations organizations. We look at CDC. We look at the global organizations and how they impact you, and how can you collaborate with them in addressing your local leadership issues in your organization. From there, we come narrower and we look at your industry, your local environment. How are you in relationship to the government, county government and central government? How is that impacting you? How are your competitors impacting you? How are your collaborators impacting you? Then from the local environment, we bring it down to the institution. So we look at how do you manage your institution? And lastly, from the institution, we bring it down to the individual. How do you manage the individual? So if you look at it, would have taken you from how do you manage the individual in the institution, in the Kenyan environment, in the global environment, with this adaptive leadership approach.
The experience with LeHHO was exciting. It was eye-opening. I learned a lot, starting from learning myself and my leadership style, and learning to interact with other people and their leadership style, and just that understanding of everyone brings their strength to the table and none is less than the other. And it was through those case scenarios and through sharing with my classmates and the networks that I created in that class that was the most exciting for me.
I view this program as one that really tries to define leadership and management in a very practical way. The course is in such a way that you get case studies that help you to think outside the box, case studies that really try to bring out true situations. And then from there, you go back to your place of work and you go through a mentorship. You are now trained just based on where you are working. Some of the concepts that you learn in class, then are deployed there.
My current role is a global role. I oversee safety and quality education and training, strategy and direction for our programs in over 70 countries. My team is based in New York. I sit in Kenya. The course prepared me with that confidence of I have the tools that I need to do this job. And it helped me overcome the imposter syndrome much faster than I would have had I not been prepared with some of the facets that I have. I keep going back and referring to the notes that I have from the course. I keep going back and calling some of the classmates that I had and asking, how would you handle this, and just learn from them. So in addition to just being optimized in my leadership, I have a network of peers that I can rely on for guidance when I'm stuck.
The LeHHO program is leading high-performance healthcare organizations. So it's not just hospital, it's any health organization. So it will target public hospitals, it will target private hospitals, it will target faith-based organizations, non-governmental organizations. In fact, the usual class is a mixture of doctors, nurses, pharmacists, people working with the UN, people working in the NGO. So it's a very nice mix that enriches the class.